What are the progressive bone deformities of Paget's disease? Paget's disease of bone is a condition that leads to abnormal bone remodeling, causing progressive deformities and weakness in the bones. This disease typically progresses through phases where bone resorption occurs excessively, followed by disorganized bone formation. As a result, the affected bones become enlarged, misshapen, and weaker than normal. One of the key deformities seen in Paget's disease is bone enlargement. The affected bones grow larger due to the excessive formation of new bone. This can lead to visible changes, such as the bowing of long bones like the femur and tibia. The skull may also thicken, leading to a condition known as frontal bossing, and the pelvis can become enlarged. Bowed limbs may shorten over time, which can cause problems with walking and put extra stress on the joints. Another notable change is cortical thickening. The outer layer of the bone, known as the cortex, thickens irregularly, increasing the overall diameter of the bones. This is particularly noticeable in the long bones and vertebrae, where imaging may reveal a picture frame appearance due to the thickened cortex. Inside the bones, the spongy bone, or trabecular bone, becomes coarser and disorganized, often described as having a mosaic pattern. This reflects the chaotic nature of the bone remodeling process occurring in Paget's disease. Despite the enlargement, the new bone formed is structurally weak, which increases the risk of fractures. These fractures are particularly likely to occur on the convex side of bowed bones. Changes in the skull can also occur, leading to a cottonwool appearance due to patchy areas of abnormal bone deposition. This enlargement can increase the size of the head and may flatten the back of the skull, potentially causing facial deformities. In the pelvis, the bones may widen, and the hip socket can shift inward, which can lead to complications. The spine may also show deformities, with vertebrae becoming flattened or squared, and the internal structure becoming disorganized. Bone deformities can affect joint mechanics, leading to arthritis and pain. Additionally, enlarged bones in the skull and spine may compress nearby nerves, causing symptoms like headaches, hearing loss, or other neurological issues. From the perspective of osteoporosis, Paget's disease is a different process of bone remodeling compared to the generalized bone loss seen in osteoporosis. However, both conditions can increase the risk of fractures due to compromised bone quality. Treatments like bisphosphonates, which are effective in osteoporosis, can also help stabilize bone structure in Paget's disease by reducing abnormal bone turnover. In summary, the progressive bone deformities of Paget's disease include bone enlargement, cortical thickening, disorganized trabecular bone, bowing and shortening of long bones, skull changes, pelvic and spinal deformities, and complications from weakened bones and nerve compression. These changes develop over time as the disease progresses through its various phases of abnormal bone remodeling. Always consult with a healthcare professional for personalized medical advice regarding Paget's disease or any bone-related conditions.